We have Dr. Jill Roberts here. She's a microbiologist with the University of South Florida, and we really just wanted to get an overall grasp on what we are looking at daily when the Department of Health releases their latest coronavirus numbers. So Dr. Roberts, thank you so much for helping us with this. And we're just taking a look on page 1 here. And right here in this purple, this is the total reports, right?
Mm-hmm, yes. So
Okay.
this is what we have here. You can see monitored persons. So these are people the Florida Department of Health was told that they should probably monitor. So this data comes out from our contact tracing. So when we do have a case that is confirmed, there'll be a number of people that had contact with that particular case that the health department will now turn around and watch. And the reason that they're doing that is because the majority of the cases that we end up confirming have known contact with an infected case.
And then confirmed cases over to the right here, they split Florida residents and non-Florida residents.
Right. So the reason that we're doing this is it can get a little bit tricky later on when we go back and look at the data and see how many cases occurred in one state versus another if we have multiple states actually reporting the same case. And so we want to be sure that when we're talking about cases that do occur in Florida, we're not picking up a case of a tourist, for example, who's here for a week that then turns around and leaves and goes back to their home state.
Why does the type of testing matter?
In terms of here, the type of testing, we're kind of looking at the burden on the various laboratories, but what's important here is that those labs can be running different types of tests. So when you're looking at our Bureau of Public Health laboratories, that's our BPHL and the CDC, they're going to do a confirmation test by using the nucleic acids. So this is the RT-PCR test that we've talked about many times. However, when you see the positives by commercial and hospital laboratories, they may be using a number of different things, and some of those can be antibody tests. So that gets tricky. And so we can actually find that multiple antibody tests will tell different things. And so we have to be careful what data is being reported. Some sources want only the RT-PCR results, some sources want only the antibody results, and some people want actually both.
Characteristics of Florida residents, especially the hospitalizations. Now that looks like a running tally there. What does,
Right.
What does that tell us and what does it not tell us?
So it gives us a good idea of who is hospitalized at any given point. Okay, so we want to know what kind of burden the disease is having on our hospitalization system. That said, we have to be careful because it's at any point. So that does not mean this total number of individuals is in the hospital right now. Okay, so they were there at some time between, say, January and today. So this can help to give us a good idea of how much the hospitals are actually dealing with these types of cases and what the burden is. So remember, hospitalization, we use that term and we think about a person sitting in a hospital, but it also encapsulates costs that are involved, loss of work hours, and all these other factors that we have to think about when we make decisions moving forward.
And why only, because like even the deaths too, why only Florida residents in those hospitalizations and the death count?
Right, so again, we don't want to have duplicate data here where we have them being reported in multiple states. So it can be unclear whether the individual is actually hospitalized in the state of Florida or is hospitalized somewhere else. And so what you're going to see is in other places that there'll be more clear data that sort of breaks this out so we can get the impact. In fact, we even want to look at which hospital systems are hit the hardest. And so that is really just too much data to put in a report that's already, as we know, over 1,000 pages long.
And is that exactly why they're doing the risk factors for Florida and only Florida residents when we're looking at the risk factors?
Right, right. So we really, this whole thing is being put out by Florida Department of Health, who is tasked really with protecting our communities and the individuals who live there. So we want to talk to people from Florida about how you can protect yourself. And so early on in this outbreak, a lot of our cases were linked to travel, right? And so now we have travel is actually really stopped in most places. Most individuals obviously aren't going out on cruise ships. There's very few people flying compared to before. And so you're going to see that the majority of our cases are actually occurring endemically. So what that means is there isn't someone coming to the state of Florida bringing the disease. The disease is already established here and we're spreading it amongst residents here. And so, of course, your biggest risk factor is contact with a confirmed case.
So that confirms community spread.
Absolutely.
The red here to the left, that is on the people tested. That's what that tells us right here.
Right.
And do we know if that includes Florida or non-Florida residents?
Yeah, in terms of this one, it doesn't actually say here, so I'm not really sure. But it's interesting still to look at the data. A lot has been made about people who are awaiting testing, for example, and some people might be a little confused to say what's going on there. And so there's nothing really sinister or anything like that going on here. These generally tend to be things like someone's waiting for insurance clearing on a test, or a test is in transit. We know that it's been collected at a particular place, but it hasn't arrived at a laboratory yet. We can also get an idea by the burden of how much the labs are testing per day, how many tests will be waiting on the next day. So for example, there's nothing really bad going on here. The interesting thing is the inconclusives, and a lot of those come from antibody tests. And so antibody tests today may show up positive and show up to be negative tomorrow. And on the next day, it'd be positive again. So this is why a lot of us prefer to do the RT-PCR test rather than the antibody test, because it's a little bit more reliable.
Okay. If you come to page 2, you see a lot of bar graphs, especially for here, if we talk about this first one here about the cases confirmed in Florida residents per day for the past 2 weeks. Why is it only 2 weeks? Why are we only looking at it at a 2-week span?
Well, I think to actually reframe that question would be to say we want to look at it for at least 2 weeks. And so the reason we want to look at that for at least 2 weeks is because the cases that we're seeing today are people that got infected 2 weeks ago. Okay, so remember what causes infections is contact with someone who was infected. So if we go back 2 weeks ago, there were 1,249 confirmed infected people. How many people did they actually have contact with? And so now we look out to this date and we have 3,000 in some cases. So that you had a really big jump in that time frame. So the reality is we want to watch trends. So to be very scared, the modeling puts us at 7,000 cases in 2 weeks. So based on the numbers that we're seeing right now, if we don't take extreme measures, right? And so it's really important that we look over the past 2 weeks and say, are we trending up? Are we trending down? Are we staying stable? If we're trending down, we've done a really, really good job on our social distancing, right? If we're trending up, something's wrong. We're not doing something we need to be doing. A lot of people have said, well, are we at that point where we need to shut down the economy again? That's pulling out the really, really big guns, right? There's something much easier to do, and that is to use masks. So if we use masks, we can prevent those 1,200 cases 2 weeks ago from becoming 3,300 cases today.
You know, it's interesting too, when you look at this blue one, it says cases confirmed in Florida residents, but then if you look at the red one right below it, it says laboratory testing for Florida and non-Florida residents.
Right, right. So the labs are going to get results probably for both people, right? And so in the cases above, they've actually probably teased out the people who were tested that came from other states. But the laboratory testing data gets really tricky. And I want to just kind of warn people here, if you're looking at this particular piece of data, you can have the same person in here multiple times. Not on one day. One day we'll only have them once. But let me give you an example. Say on Wednesday, somebody went to the hospital, or rather went to one of the testing sites because they were feeling ill and they got tested. So then the next day they're feeling worse. They go to one of our outpatient things and they get tested. So the outpatient facility tells them, if you're feeling this, you should go to the hospital. So on day 3, they go to the hospital and they get tested. That person is going to appear Wednesday, Thursday, and Friday, but only once on each of those days. So these testing results can get a little bit tricky because the same person can be in there multiple times. And so that's been actually criticized by a number of individuals that said we shouldn't really be doing that, but in reality, it gives us a good idea of how much testing we're doing, and we need to know that. The figure of how much testing and how much coverage we're getting is really important. So I'd be careful of making too much assumptions based on this data. In fact, this is not the piece of data that I think is most important for lay people to look at, but the one that comes up next is even worse.
The
so
number
this
in
is
percent.
better than the percent positives.
This one right here?
Yeah, so percent positives is where it starts to get really, really ugly with people making assumptions based on the percent positives who don't really understand what this data means, okay? And so if I were to give you a quick math of percent positive, if we had one case and I tested 10 people, my percent positive is 10%. If we have one case and I test 100 people, my percent positive is 1%, right? So the percent positive changed from 10% to 1%, but we had the same number of cases. So it's the case number that's important. That's the burden on the healthcare system. That's the person that can spread to other people. That's the person that actually needs contact tracing. So the problem with percent positive is it varies due to how much testing we do. So you cannot compare percent positive from one day to the next unless the number of tests is the same. And so there are a lot of people that are actually using this to say, well, percent positive looks good. We can reopen the economy. That's only one metric. We could look at it. If the percent positive is under 5%, that might be a good indicator that we could reopen the economy, but only if we look at these other factors as well. So if you kind of back up on that data a little bit and look at the chart on the top and then look at this one together, it actually can help you out because you can figure out, yeah, so actually not the blue one, but the next one down, the red one. If we see days in which the number of tests that were done were very similar, and then look at the percent positives, we can actually look and say, are they similar? So you have one day on 6/10, see the number of testing is about, or at the 6/11, 34,000, and then 6/14, 34,000. So then go below and look at 6/11 and 6/14. Your percent positivity jumped from 6.63 to 6.69. Okay, so your percent positivity really went up even though your number of tests were exactly, well, close to the same. You can look at ones that are much, much worse. So then go out to today. You're still 34,000 people tested, right? Or rather 618. But now your percent positives is 11. Your cases are really going up. You tested the same number of individuals those 3 times, but your percent positivity actually went up. Okay, so when you have changes in the number of tests that are done, the percent positivity becomes not so reliable in making assumptions, but when it's the same, it can be very helpful. A statistician can do this though. They can actually do the math to figure out whether the case numbers were really going up, and this is why they were saying days ago they were. So why do we do it? Percent positivity tells me whether we're testing enough people, and that's it. Okay. If the percent positivity is under 5%, we're testing enough people. So let's look at today. Are we testing enough people? Nope. We're at 11.6% positivity. We're not testing enough people. So what this tells me is we're only picking up the sickest people. The people that are actually going to get tested are the ones that we're picking up, and they're all positive. Means there's a whole lot of people out there that are probably positive and the test isn't picking them up. So this is an indication we need to start testing more people. As we start getting higher and higher numbers of cases, we have to test more people.
So then would that just be people that maybe had contact with somebody, they don't feel ill, so they don't feel like they need to go and get tested? So is that something that people...
If I was betting on this, I would say it's the result of the fact that the people that are getting sick are young. So they're not that sick. They have mild disease. They have less symptoms. They don't feel the need to go and get tested. In addition to that, we have to look at the demographics. Okay, so if we look in Hillsborough County, our hot zone right now is one of the lowest socioeconomic areas in Hillsborough County. So how do you get tested? How do you pay for it? How do you even physically get to the testing site if you don't have a vehicle or you don't have a bus that's going in that area? So I would suspect this is an artifact of who's getting infected right now. So the health department can address this, right? They can go out to that area. They can move mobile testing out into that area. They can provide free testing, but that also relies on contact tracing. So the contact tracers need to know who to test. And so all those things kind of work together. So percent positive is actually the last metric I would want to show to the public because a lot is made out of it without really understanding what it means.
Looking at the percent positivity for new cases, this only counts new people?
Yeah, it only counts new people. So this was a criticism that had come a little while ago that said, okay, that data we showed you a little bit earlier on, could actually include people that got tested again. And so there have been cases where people have remained positive on a test for weeks and weeks. And so every time they get tested again, and by the way, the reason they're getting tested again is to see if they can return to work, right?
Yeah.
And so they're getting tested again, they show up in the data again and again and again and again. So just like I was saying, that guy, my fictional guy that got tested on Wednesday, Thursday, Friday, showed up 3 times in the data, this takes those out. So this is going to tell me these are just the new ones, new people that got infected. Why that's kind of important to look at too is now we have all these new people that got infected 2 weeks ago, and who are their contacts? So now we have to start going out and looking at this. So the contact picture is actually getting a little scary. We're exceeding the number of cases for which we can do contact tracing. And so if we can't go out and find all these people and warn them and quarantine them, what do you think the next best measure? Mandatory mask policy. So we can't find the hot spots, then we just protect everybody.
Okay, so just be looking at this correctly. So we can't compare to the other chart with the number of positive cases per day because that only includes Florida residents?
Right, right. So a lot of times if you try to do the math from table to table, you'll find that it won't add up. And sometimes it'll even add up to over 100%. So you just can't do that table from table. Really, all these things are teased out into tables like this because of that reason exactly. And so, yeah, you have to be really, really careful. And I would say a lot of people will use the statistics for their own personal gain, even though they don't necessarily say what they think they say. We actually teach that, by the way. When we teach students statistics, we actually use a book that's called How to Lie with Statistics to teach you how to do it wrong, so that when you're working in the field, you can recognize when stats have been done incorrectly. So, oh yeah, wow. Florida cases. Yeah, so this is really interesting, looking at the characteristics of our Florida cases. Very early on, a lot of our cases were in that 75 and up. And the reason was because we were seeing outbreaks in our long-term care facilities.
Yeah.
And so obviously we've taken a lot of steps to prevent that from happening. And thank goodness, right? Because they were accounting for a huge amount of the hospitalizations and unfortunately the majority of the deaths. And so as we've gotten that under control, you can see our cases have really shifted down into those younger age groups. When you look at this on a county by county basis, it's actually really interesting. So even some of the counties where the highest amount of population is a little bit older, you still see the cases in the younger people. And that's because they're highly mobile, right? So the young kids are going back out again, they're going to work, they're going to restaurants, they're going to nightclubs, they're moving around. And so you see a lot more cases in that. But we do have an even spread around a lot of the cases. If you want to be very optimistic and look at the data here, you'll see that you're under 14 accounts for very few cases. We don't really know why yet, whether it's that the kids aren't coming into contact with people because they're out of school, they're not going to work, or whether they really truly are not as susceptible. But it's probably all of these things into play. Also, they get very mild disease, so they're unlikely to get reported. So, but then in those other groups, we can see these all going up. So the really important lesson here, I think that you should take, especially if you're a young person, is you are vulnerable. Yeah, you may not actually get serious disease, but you're going to get sick and it's going to knock you out for a while. You could have long-term effects due to the lung damage that's possible with this particular disease. And most importantly, you could spread it to somebody who could get serious disease.
Yeah, it's interesting looking at too that there's more hospitalizations in the 0 to 4 years than there is in the 5 to 14 years.
Yeah. So you think about very, very young kids being highly susceptible to issues with this because they don't have a response. What's interesting is when we go into a little bit older groups, it's possible that the reason they don't have so many cases is because they're sick all the time. They get coronaviruses frequently. And because of that, they're getting cross-reactivity from recent coronavirus infections that are actually protecting them from this one.
And this too, this is only Florida residents. This is only a characteristic of Florida residents. This does not include the non-Florida residents.
Right, and I do want to make a clarification that a lot of people do still believe that the highest population in Florida is the elderly, and they're wrong. The highest population in Florida is actually in that 18 to 24 group. And so we aren't, we do have a high number of individuals who are susceptible if they're moving around within those particular age groups.
All right, let's go down to deaths in Florida residents and staff of long-term care facilities. And this kind of, does it show us a kind of a concentration in a certain region?
Well, it did. I would say that that Miami-Dade counties got hit really hard.
Yeah.
And as you can imagine, there was a large amount of retirees in those areas. Their LTCs, the long-term cares, are very common. So there's a lot of them. So you had a lot of individuals there that got sick. And unfortunately, those were the early trends. Nowadays, we don't see as many of these, but they do happen. And so if you do get coronavirus into a population that is at high risk, it can spread very rapidly. And of course, we can see a large number of deaths in the elderly. And this is unfortunate. One interesting thing I want to point out about that is if you do have one of these occur in your county or your community, it can skew that other data. So we were looking at that percent positivity data and the deaths data. If you have one of these outbreaks occur where there's 80 to 100 cases, it can make it look like the circumstances in your community are really bad because your percent positivity data will go sky high because everybody in that facility will get tested. But in reality, it's isolated to that facility. It isn't in the community around. So that's why I, again, would caution against using the percent positivity too much.
And what's interesting about this too, they used to give us a case number for long-term care facilities instead of just deaths, and they added the deaths a few weeks after doing data. Now they've taken the cases off of this sheet, so we really don't have looking just at this, we don't really have that 2-week snapshot to see if cases are getting better or worse in our long-term care facilities.
Right. So this is just getting to be too much data to handle in these reports when it's they're bringing one out every day. And so I have a feeling a lot of that data has been removed just because it isn't as significant now as it was early on in the outbreaks.
Let's go down to characteristics of Florida and non-Florida residents. And kind of what this shows us, again, kind of the cases, really what regions they're really hitting at.
Right. So as
the
we
counties
know,
with the most cases.
We are definitely a snowbird state. We have a lot of people who will spend part of their year living in the state of Florida. They don't necessarily become Florida residents when they do that, although some do. Many remain residency in other places, and in fact, sometimes other countries. As you know, we have a lot of people come down from Canada. And so the individuals, they're kind of spread across the same counties that we're seeing the rest of the cases at, right? And so there are a lot of people that are coming in from out of state that are living here for part of the year, but also we have travel. And so as you know, this has kind of become a big story recently, is that we were doing quarantine for people coming into Florida from New York because of the high number of cases. And now New York is threatening to do that to us. So we're quarantine Florida residents that are traveling to New York. It makes sense. So for the same reason, if the cases are spiking, the cases are spiking. So yeah, you're going to see a lot of travel here. I don't see too much of the travel now to our big tourist sites because a lot of them have been closed, but you will generally see that in here as well. So probably earlier on, we had a lot of travel to the Orlando area and that sort of thing.
And yeah, and this chart is not showing us a gender, age, or ethnicity.
Nah, so you can't really break it down to know which of those groups of travelers, but we all know Florida, of course, it is a tourist state. There was news very early on about not closing the beaches for spring break, and so we know that the people were traveling at that point as well. And non-residents, by the way, it would be interesting to see whether that non-resident factor is actually picking up things like migrant farm workers and people who are not documented, for example. And so we don't tease that out here, so we don't really know the role of those individuals as well.
That's the thing we've asked too, because I know that's an area that's been brought up recently,
Yeah,
having a big percentage, and we've asked for that data because, you know, we know nursing homes and jails and can do that percentage together to see where they
sure.
are in overall cases, but we really don't know if the migrant and farm workers, if they're counted as our Florida residents or non-Florida residents, and where they stand on that percentage base of our overall numbers.
Right, and this would be important to look at. I think we're noting in Hillsborough County, as I said again, we got a hot zone in 33612, which is right next to the university. So 33612 has a very high population density, but it does not have any farms. So the question is, are there migrant farm workers who are actually commuting to that area that do live there, that do actually account for some of these cases, or is that not a player in that area at all? I would suspect personally that's the socioeconomic factors, that you have an area in which there's a lot of comorbidity. So there's diabetes, there's asthma, there's heart disease, and those are more severe cases. So they're getting reported.
All right, let's go through this, the zip code. I was looking through some of the zip code data the other day, and just kind of like these small, the ones that have like one and stuff, and it just seems like we're, some of the data where it says homeless Hillsborough, homeless Pinellas there,
Yeah.
where that, you know, where that case, you know, did come from, what zip code that was, or where it would be, to show that it's kind of in its a category of itself, but it did come somewhere. It came from somewhere in some zip code. We just don't know for sure where it originated.
Sure.
Looking at that.
And really, the zip codes is one of the easiest ways to collate this data, which is why a lot of people will do this. But you could look at it in totally different ways. If we wanted to look at it by socioeconomic, by population density, that would change all of this, right? And so, but the zip code is helpful. So it does give us an idea in public health as where to target our limited resources. You know, we only have so many contact tracers. So if we know that it's this area right around the university that we need to go hit, that's the hotspot. That's where we need to go hit. So this is interesting data. I actually was looking at this over the last few days, expecting those numbers to tick up a little bit. So what we're looking at here, your daily percentage of emergency department visits. So if we have really severe cases, those that require hospitalizations and that may unfortunately ultimately end in death, that is often preceded by admissions or visits to the emergency department. That also gives us a good idea of whether or not our healthcare system might get into trouble again, where we start having too many cases pour in. And so obviously we can see where the dates were where we were really bad, right? And so some would argue that this was our first peak. And then some of us would argue that we've never left the first peak and we're still actually in that first one. And so we'll wait and we'll see what this data does. So the unfortunate thing that I see looking at here is that daily percentage is ticking up a little bit over this last couple of days. And so I would expect that as we see more cases, we will start to see more severe cases. Not surprisingly, you're going to have an older demographic that is actually going to visit the emergency department. And this is something we're going to have to keep a really close eye on over the next few days. One thing I would compare with this data is look at the ICU bed usage. Okay, so if we're seeing severe cases that are ending up in the ICUs, that's something we have to take very, very seriously. I think using a mandatory mask policy is one way to prevent that. So we don't want to get there, right? We don't want to have to go back to that point where we're starting to close things down again and go back home, and our mask can prevent that.
And this again is just percentages. This is not a number.
Yeah, this isn't a number, but it's an early warning. It's an early warning that we have to take very seriously, that if we start to see people trickling back in, we're in trouble.
Okay, and this here is all persons with tests reported. That's what this table includes. It basically breaks down the numbers of combined residents and non-residents overall.
Yeah.
Right?
Yeah, this should be everybody, and then we should get a good idea of who's going to get tested, and hopefully we can take a look if there's any problems. And so sometimes this can also give us an early warning too, to say, well, there was a lot of cases in that particular county, but they weren't testing that many people. And so as I said today, if we're looking at a percent positivity rate over 5%, we're not testing enough people. And so we can look more closely and say which county isn't testing enough people, where are the cases actually occurring at, and which county and how much testing is being done there. That's the ones that we want to target to get the test numbers up.
Why is testing by laboratory important?
Well, this tells us who's doing the tests and to give us a good idea of the burden on the healthcare system as well, and as well as the costs. And so what you're seeing on the top of this is Quest Diagnostic, which is a huge private laboratory, right? And so these are tests probably being sent out by everybody from hospitals to people's doctors' offices to even some of the testing sites that may be out there. For the most part, that gives us a little bit of data on billing as well. And so we know that Quest is actually a pay for service, right? So whereas the health department may be offering some testing for free. So it gives us an idea of who's paying for this. Is it a private insurer or is it the state? And so one thing I would note on there was that Tampa General was a major player in sending tests out there. And so that gives you an idea of the volume of that the hospitals are actually handling. And you could have seen Adventist in there as well if you were looking for our local players. They're doing an awful lot of testing.
Here we go. Why is this important? So take a look at these.
Yeah, so this is really important data to have because we don't want duplicate cases in the deaths. And so we need to have some demographics on each individual that's actually recorded here. In addition to that, it gives us a way to target our public health efforts. And so if we're taking a look at this and we see no infants that are dying, that's not our target audience, right? That's not where we need to put our efforts. We see teenagers, there's no teenagers in here. What we're continuing to see is that the deaths are occurring in people who are older, right? So they have the increased risk factors. So we have to continue to give our same public health messaging that we have over and over again, that now is not the time to go and visit your grandparents. You cannot go into the long-term care facilities. The PPE needs to continue to go to those places so it can keep the residents safe. We need to continue to make sure those places are following all the guidelines that are in place to protect the residents that are there. And in the individuals who are not in LTCs, remember, we're not talking, the entire population above a certain age does not exist in a long-term care facility. Many people are living in their homes and may still be taking unnecessary risks. And so I think we've all seen it, where you're at the grocery store, whatever place, and you may see an older individual who isn't wearing a mask. And so it's really important that we get that data out there and continue to say, you know, you need to take precautions. You need to know that if you're at the grocery store and you're surrounded with individuals there that aren't wearing masks, you're at high risk. So maybe this is the time to have your groceries delivered or have somebody do that job for you. And so I don't want to give people no hope. You know, eventually I think we will have a vaccine and we can go back to a better state of normal. And we already do have a few treatments that are working, but this is really important. We need to know where the cases are occurring and where the deaths are occurring, and really target as much as we can prevention in those efforts.
But the big thing too, though, this death list, especially when we're looking at the deaths in the state of Florida, it only includes Florida residents. It's not people who have been here working or, you know, maybe they're snowbirds or somebody. It's literally just Florida residents in this data.
Right. So this should be only Florida residents that have died here. And that's important. They do have a list, by the way, of non-residents. But yeah, that's important because, again, we're targeting our public health efforts, and this is coming from Florida Department of Health. So it's most important that we do serve the citizens that do live in the state in the best way possible. But in addition, this tells us a lot about our contact tracing, right? Because we know this individual was sick. We will want to know, where did they get it from? We need to know, is it a chain of infection that we can shut down? So yeah, this is our Florida residents.
I started, the first week we started collecting this data, just typing in my own data, just looking at the data, and it was a few pages when I first started, and we are scrolling. And I can even see as you're scrolling through, I can see a few that are suspect that are saying same county, same age, same date of infection. Yeah. It's probably a duplicate that will come out in tomorrow's data. And I think the next category we're going to get to here as we scroll through the deaths here is the coronavirus line list of cases. Again, this is just Florida residents.
Yeah. And you can see some travel there too. And so that's kind of interesting. Remember, we go back and You can even look at the dates on these. You notice that those are back before we closed down a lot of the travel that was going on.
Here is the county data now when it comes to coronavirus cases, and just looking at Hillsborough County, there's lots of similarities in the county by county report as we see in the state report, correct?
Right, right. So you're going to have a lot of similar data that's actually here, but it's broken down by our county. And one of the reasons that this is really useful, especially for us, is because we have a Hillsborough County Health Department. And so we're going to have our own local health department as opposed to the state health department. We can get a good idea of what we need to do within our own county and how to target our resources here. This data doesn't look great, right? So when we're looking at the cases, we can definitely see our case numbers going up in Hillsborough County. In addition to that, though, a really interesting thing is the next piece. Is notice the median age going down, okay? So what this is telling us is that we in Hillsborough County have younger people that are accounting for the cases over the last few weeks. Now, there's a number of reasons for why that this may happen, but again, as I've mentioned, that young people are just very, very mobile. And so they're getting out, they're going back to work, they're going to various places. Unfortunately, they're getting into crowds of individuals. And so we do have the possibility for spread here. So as we break it out by each county, you'll notice they also include some data for the state overall. And so this can give us a good idea of how we compare to the state. So when you're looking over here in hospitalizations, you can see our hospitalizations in Hillsborough County and then our deaths, and this is going to be cumulative data as well. But then when you look below, you can see the statewide hospitalizations and death data. So the percentages are a good thing to compare.
And that's current, right? That's a current current percentage on a tally when we're looking at the long-term care and the hospitalizations and deaths and stuff.
Right, right. So if we're looking at our hospitalizations, about 11% of all cases in Hillsborough County end up hospitalized, but about 15% of all cases statewide end up hospitalized. Hillsborough County actually has a little bit younger median age, and so that may actually account for us having a little bit less percentage of actually hospitalization and deaths than other places. Now, when you go down the bottom, one thing that's really important is we know that long-term care facilities and correctional facilities are high-risk exposures. They're high-risk environments where it's very hard to do any type of social distancing, and you have people who are at high risk. So this data is actually included to let us know what percentage of all that, or what numbers of all those are actually people that were in long-term care. And so you can see that we're running neck and neck with the state at 13%. And so that's not really all that surprising. On the correctional facility, we don't have any really, really large prisons within Hillsborough County. Yeah. And so that's why we're going to see a little bit different. While we have jails and other places, there's no huge prison there. So we wouldn't expect to see much going on there. On the other
only
side,
Florida residents too, right? All this data.
Yeah, this should be only Florida residents. So yeah, exactly. And so that's really targeted. We definitely want to kind of drill down into this data locally. So we have a good idea of who we need to go out and target. And so when we look over here, we also have some data that breaks it down by race and ethnicity. And there's reasons why that this is really important. We've seen some disparities where there's higher amounts of hospitalizations and higher amount of deaths in persons of color and in Hispanics. And so it's really important to track those metrics. It can be hard to track the metrics with just the data we're given here. Okay, so when we're just looking at the percentages, what's important to do is compare that to the percentage of people who are of that description in the state, but that's not here. Okay, so where we work for disparities is, say for example, the population of our county is 20% Hispanic, but yet there are 30% of those people who are hospitalized, and I just use those fictional numbers. There's a disparity going on there. That shouldn't actually occur, but it sometimes does. We can't really tell from the data that's given here. We need a few more numbers, but this is important to actually track.
And the same for the laboratory testing. It's Florida and non-Florida, but it doesn't include those inconclusive tests, right?
Right, right. So this is actually going to help us give a good idea of how well we're doing testing in Hillsborough County. And so again, I caution, don't interpret the percent positive. What this is telling us here is if that's our percent positive is 14.1% in Hillsborough County, we are not testing enough people in Hillsborough County. We need to do more testing. The reality is, and there's been estimates all over the place with this, and so there are some people that believe that the number that you actually see is 10 times lower than what is really out there. So if we're seeing, 3,700 cases, that means it's actually, actually 37,000 cases. And so it would be impossible to know whether that's true or not until we do true serology, where we test everybody to see if they were exposed at some point or another. So, but this just gives us an idea that we're only picking up some of the cases that are out there. It's not enough. We need to test more.
What do you look at particular? Is there any data or websites or anything that you look at?
Well, I favor the dashboards, of course, because the way that they describe and show the data on the Florida dashboards it's nice. The way the graphics look is easier for me to use for students to follow, just because of the way that it's shown there. Obviously, look at the same reports that we're looking at here. If I want to get worried, I look at the ICU reports. So ICU report today, it's getting a little questionable, and certain hospitals are starting to lose capacity, and that worries me a little bit. And I love the Johns Hopkins site, of course. It has aggregate data as well. And so those are the ones that I generally would tend to look at. The Florida dashboard is actually pretty well done. The way the graphics are shown there is really interesting. I know the controversy around the other Florida dashboard. So it's hard to know which one is actually better and how much of the story is true and not true. So we've looked at the data a little bit, and I'm not sure there's much difference between the two dashboards.
I think, yeah, I think sometimes too, the dashboard, when I look at this, the Department of Health dashboard, sometimes the testing numbers aren't up to date. I remember looking
at they're usually running behind.
With one of our Georgia reporters, and he had an overall testing number, and he's like, well, he's got from the dashboard. I'm like, well, look at this report, and it was a pretty big difference there in the two numbers. And so there was sometimes there's a difference between what that dashboard says and then what this data here in this report says.
Yep. Yeah, this is the same as the state one, but it's broken down just for Hillsborough County. And so that can be important if you have hotspots in the state. So for example, the data for the whole state might look a little bit flatter, but when you pull out one of your bad counties, which unfortunately we are right now, it can actually look worse. And so as you can see this one, you can see that we're trending upwards on that weekly count, both on the right-hand sides for influenza-like illness and COVID-like illness. I would expect us to trend up for influenza-like illness if it was like, say, December. So, however, because it is the middle of the summer, I would say this is most likely to be COVID. So that's unfortunate. As we start to see that, that's when we start to get worried, and we start looking at that ICU. How much beds do we have available? That type of data.
Dr. Roberts, thank you so much for just going through step by step and really giving us a better look at understanding this data, because it is so important and something that so many people are paying attention to right now.
Well, thank you so much for inviting me. I hope that people will take it to heart that those case numbers are going up, and continue to wear your mask and protect yourself and your family and those around you.
Perfect. Thank you so much. Have a good day.
You too.